Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will celebrate 5 years of Health Watch and talk with Shelburne Stevens, Novant Health Brunswick Medical Center's president, about the progress of the hospital and the medical group in the past 5 years. Next, we'll meet Barbara Corey, who survived a shark attack last summer. We will talk with her specifically about her experiences at Novant Health Brunswick Medical Center. Finally, we'll meet Dr. Stephen Robbins, who's a new urologist with Novant Health Urology Partners. Stay tuned to learn about valuable health topics with Health Watch. Our first guest today is Shelburne Stevens, president of Novant Health Brunswick Medical Center. Well, welcome back to the show, Shelburne. It's such a pleasure to have you.
Thank you, June. It's always great to be here with you.
Well, the last time you were here, we heard lots of good stuff, and I'm hoping for the same this time. But as a reminder, let our viewers know what your title is and a little bit about your background.
Great. I'm the president of Novant Health Brunswick Medical Center. I've been here now for 8 years locally. I've been with Novant Health. I'm going into my 25th year with the company. Started out years ago as a respiratory therapist and had a variety of roles up in Winston-Salem, and was the director there of cardiopulmonary services when I left, and then came down here to Brunswick and have loved the area and loved the people here.
Mm-hmm. It's a great place to live. We love it.
Absolutely.
Well, today we specifically wanted to have you here to celebrate our 5th year of doing Health Watch. So it's our anniversary year. We're going to do some special things during these months. So we wanted to kind of have a snapshot of what's happened at the Brunswick Medical Center since the last time you were here. I know lots of things have changed. So let's talk a little bit about that.
A lot has changed. It's continually changing. And in that 5 years...
Well, your role's changed a lot.
My role has changed. 5 years ago when you started this show, I was working with our ambulatory markets,
right.
Outpatient centers and surgery centers and imaging centers. And then shortly after that, I became the senior director of operations with the facility and really began to lead the building of the hospital and working with Denise on that as she was the president then. And then
yes, we had Denise on the show many times.
Yes, and then 2 years ago when she left and moved to Winston with Novant Health, I took over as the president of the medical center, and it's been so much fun in the last 2 years.
I'm
it's
sure.
A great team there. The staff and physicians are just remarkable, and seen lots of growth.
Well, you bring up the hospital, and that's a major accomplishment in the last 5 years here in Brunswick County. Let's talk a little bit about that facility. What makes that so unique and so special?
It's just a gorgeous facility to begin with. We have lots of space. We have all private rooms that are very large. They all have day beds in them for the guest. They have private bathrooms with nice large showers. A lot of the people really don't want to leave when it's discharge time. They want to stay. They have their dining on call.
Yeah, food's pretty good too.
The food is great, but you can call and order what you want according to your diet.
And when you want it.
And they'll deliver it when you want it. And it's just, we get the best feedback from our patients and their family members. It's just awesome. And the facility itself, like I said, was large. The hallways are large, so there's not clutter in the hallways. Right. And our environmental services staff and engineering staff do a great job.
Your floors shine, I have to tell you that.
They do. They do a great job keeping that facility really, really looking good.
Well, how about technology?
We've added a lot. Recently was the patient education channel that is both in English and in Spanish.
Right, we had Stephanie on talking about that.
Yes, and that has been a huge hit with the patients and their families. Just they can watch it when they want to. There's a variety of topics on there, especially for our Hispanic-speaking population. We don't have a lot of folks who can speak Spanish fluently. We do have interpreters, but being able to watch those educational channels in your native language is very important.
That's great. I never even thought about that.
We've also added robotic surgery, the Da Vinci, our urologist and OBGYN surgeons, and we have one general surgeon who recently was trained trained in that, and they all do a remarkable job. And as people surf on the internet, they read about these new technologies, and they come asking for that. So we are able to present that there.
Actually, the new urologist is going to be on the show today after you, so he'll be talking about the robotics.
Great.
That's great. Well, I know that during the last year, Novant Health went through a branding change. And so it's a sea of purple everywhere, as though I think you call it aubergine. Is that correct?
Is correct.
Let's talk about that brand change a little bit. And how did that affect Novant Health Brunswick Medical Center?
It really put all of our facilities and our physicians' clinics under one brand name. Before, we all had separate individual names, and no one knew that one hospital was part of Novant Health and the one down the street was. So it really puts all of our facilities and our clinics under one brand name of Novant Health. And aubergine is a broad color that no one else has taken on, and it really stands out. And we hear lots of compliments around the new brand. And with that came the brand promise.
Yeah, let's talk about that.
We're going to deliver a remarkable health care when and where you need it and make it convenient for you with world-class technology. And I think we've really done that, especially with the new medical center.
Yeah, that has been, it's so striking, that color. Typically you see blue, green, red maybe, but that aubergine really stands out. And I know when I go to events, and you're so recognizable because it's a sea of purple, as everyone says, but a sea of aubergine. So I think that's great. Let's talk a little bit about the Novant Health Medical Group. I know that the practices have grown immensely over the past 5 years. I know we've added lots of physicians in our area. So tell us a little bit about that.
We've added a lot of specialists with our surgeons, our OBGYN physicians, the urologists. But when I go out in the community to speak to groups, the one thing I hear is we need more primary care. We need a lot more primary care, and we have been able to deliver on that since we've opened up the medical center. Physicians want to come to the area. They're learning more and more about it. We have a state-of-the-art facility for their patients to go to, and our physician recruitment has just increased tremendously.
Really?
We had a lot of people move into new clinics.
Yeah, I just realized there were some new signage up on some buildings that I hadn't realized they'd moved.
Yeah, Oceanside Family Medicine and Convenient Care in Charlotte moved into a new building a couple of years ago. Right. Great state-of-the-art facility with the numerous providers there. And
there are a lot there.
Their convenient care hours on the weekends. And then we recently opened up Oceanside Family Medicine in Southport with Dr. John Moore. And he has 2 new partners coming on by around October. They'll both be here. And they're females, which has been a big need. And then we have Oceanside Family Medicine in Bolivia with Dr. Hamby that has opened up, and he has Dr. Asbury that's joining him later this fall as well. So we've seen significant growth, and we're really meeting that need of primary care providers to the community.
Yes, when I'm out in the community and in events, I'm often asked about primary care because there just seems to be a lack of primary care in this area. Yeah. So I'm happy to hear that recruitment is going so well.
And we've even already signed one for next summer to come to the south end of the county near Calabash next summer. So recruitment is not as a struggle as it was many years ago. It's very easy now. We can be very selective.
Wow, that's great that you can be selective and get the quality that you're looking for.
Absolutely.
Yeah. Well, I know that we did talk about technology a little bit, but somebody said something to me the other day about an iris scan.
Yeah, we implemented that several months ago. So if you've been to our facility for the first time, they'll scan your iris. And then your next visit, they just scan you again, and all of your information comes up in the computer system for the folks there. So you don't have to spend a lot of time regurging all of that information with your name and your address and telephone numbers. We have you look at the screen and just make sure it's all correct. So it's much more efficient for patients.
Along with the lines of information technology and what have you, I heard that you're getting a new electronic medical record in the hospital. Is that correct?
That is correct. We call it Dimensions, but most of the world knows it as Epic.
Epic?
It is a true electronic medical record. There'll be computers in every room, and it's just going to give the staff more time at the bedside with the patients where they should be. And it's just a great resource. We've already started the planning, and it goes live next summer.
Live in 15.
Yeah.
Wow, well, that's awesome.
It is.
Tell me a little bit about what's going on in the community.
We're out in the community all the time. We in the past year, have had a large community wellness initiative where we've been going out doing screenings around obesity, high blood pressure, diabetes, and pre-diabetes testing, and just educating the community on these issues because they're out there and they're big, and we need to address them. And wellness is just a big focus for us out in the community.
Right. It's much better to keep people healthy and well than to treat it later.
Absolutely.
When they're sick. So those screenings are really, really valuable, and I think that's great. Well, what's in the future?
We never know. We're continuing to grow. Our physician recruitment is very important. The people in Brunswick County are utilizing the new medical center. They seem very happy with the service that we have there. So we've seen significant growth, and we just hope to continue to grow and provide those needs. And if there's people out there who want to hear more about us, we'd love to come talk to them and tell them about the service. They just need to give us a call and let us know.
Oh, that would be awesome. Yeah. Well, time has flown by. We're out of time now. As always, it was a pleasure, but thanks for celebrating with us. We're so happy that we've been with ATMC now for 5 years, and it's great having guests like you, and I look forward to seeing you again in year 6.
Me too. Look forward to it.
All right. Thanks a lot. Our second guest today is Barbara Corey, who is here to share with us about her experiences at Novant Health Brunswick Medical Center. Welcome to the show today, Barbara.
Thank you very much.
We're glad to have you here today to talk about your experience at Novant Health Brunswick Medical Center. But to start off, tell me a little bit about yourself. Do you live in Brunswick County?
Yes, I live in Supply, just about 5 minutes from Holden Beach. And I'm 64 and pretty much a lifelong surfer since I was 14 when I started.
Wow, that's great. Well, I understand that you were involved in a shark attack last summer.
Yes, I was.
Well, that sounds awful. I know you were surfing, but I don't know too much about what happened. Can you tell me what happened that day?
Sure. Well, actually, I was teaching a lesson to a 10-year-old girl while
and
she was surfing. But we were standing in the water because the water was very rough and very murky that day, and I was holding the board because the current was really strong, and she was just too small to control the board on her own.
Yes.
And I was waiting for her to get back on the board to help her get into another wave, and next thing I knew, it was like being hit by a freight train with teeth, and a shark was clamped onto my foot.
Oh, that must have been so scary.
It was really scary, and all I could think of doing was I just looked at the little girl and I said, "Run, I've been bit by a shark."
Really? You had the sense to say that to her?
Oh, yeah, and I didn't want to tell her that the shark was still attached to my foot.
Oh, my goodness.
I just said, "Run, go to shore. I've been bit by a shark."
Was she able to then run, or did she have to use the board?
She was trying to make her way in. Like I said, the current was really strong, and so it was a little slow, and I yelled to the beach, and her brother started running out, and I was holding a surfboard and kicking with my other foot, trying to get the shark off, and he finally let go, and I jumped up on the board, and we were both pretty much going in at the same time, and then her brother ran out and finally got to her and picked her up, and I rode the board the rest of the way in on my belly, and then they picked me up and carried me to a blanket on the beach where I waited for the EMTs.
Yeah. Once you were out of the water, then what happened next?
Well, I told them, I was telling the people on the beach really what to do because they were trying to put a tourniquet on my leg, which was all wrong. And I'm like, no, ice and a towel and pressure. That's all I need. And finally, 2 people emerged from the crowd, and one was a nurse practitioner and the other one was a nurse. And they're like, "Yes, do what she says. Take that tourniquet off you're trying to put on her, and a towel and ice." And then they, stopped the bleeding pretty much, or put pressure on it and held my foot up. I was laying down so I didn't get real shocky, and I was pretty much coherent the entire time and just talking with people. And
well, obviously you were, because you remember all the fine details of this, and I have goosebumps right now. I was like, oh no.
It was pretty scary. I mean, it's the scariest thing that ever happened to me in my lifetime,
So the EMS came and picked you up, and they took you where?
They took me to Novant Hospital, Brunswick Novant Hospital.
So they took you to Novant Health Brunswick Medical Center, and tell me about that experience. What happened when you got there?
When I got there, everybody already knew they were bringing in,
of course,
somebody bit
a shark bite.
by a shark bite. And so, not only did I have Dr. Hannah and my nurse, Richard.
Oh, he's great, yeah.
Richard's wonderful. They're both sweet. But I think everybody that was on staff that day came in to see me and talk to me. People were like peeking around the corner, and the guys that surf in the hospital, they were all in to talk to me, because I knew like Jessie, I knew little Jessie, and so they were all in to talk to me, and and I just waited. I had to wait a long time for surgery because.
Did you have surgery on your foot then?
Oh yes, definitely, and because Dr. Layton was already in surgery, he was the surgeon on call that day.
So you had surgery by Dr. Layton very soon then
that
day.
Well, that day, yes, it wasn't very soon. Like he was, I had to wait till he was done.
Well, yeah, you had to wait your turn. Right?
I had to wait my turn. Yeah, so I was in ER.
Well, I'm sure there was a lot of prep they had to do for you though first before the surgery. I'm sure you were getting antibiotics and all sorts of things.
Yeah, they put me on antibiotics and some pain medicine that Dr. Layton prescribed. They had to. They sent him the pictures while he was in surgery, so they didn't want to do anything without his permission.
Right.
So,
how long were you in the hospital?
I wasn't in the hospital very long. Thursday night, Friday, and then I was out Saturday afternoon. So.
Wow, that's pretty good.
Oh yeah.
Yeah. Did you have physical therapy?
Eventually, I did. Yes.
Mm-hmm. But did you have to let the wound heal and all that?
Yes, I was actually in bed for 6 weeks. I wasn't allowed to put any weight at all on it because it was so tentatively put back together. And then I had another 4 weeks in a walking cast, and then they finally let me do physical therapy.
Had you ever had a brush with a shark before?
Yes.
Really?
But,
you had not been bitten, but you had been in the area.
But had you
ever felt them go past you?
Yes, one time I did. I got bumped by a shark, but those sharks were like non-aggressive type sharks where, they feel that because of how aggressive the shark that was on me was a bull shark. And from measuring the bite mark on my foot, they're estimating between 5 and 6 feet. So it was a healthy shark.
Oh, yeah.
So, but yeah, I've had other encounters and seen fins go by, but, I've just paddle very quietly, in. Yeah. You don't want to thrash around, when you see one.
And that's what you do naturally,
Naturally, you're scared. Oh, no, you want to be as quiet as possible and not attract him to you by splashing, because if you splash, they feel like that's an injured fish in the water, and so they're more likely to come and investigate if somebody is splashing.
Interesting. Mm-hmm. Well, I'm curious. Have you been back in the water?
Yes, I have. I'm still not allowed to surf because I've had back surgery in between all of this. But I can lay down and paddle my board now, and so I have been back in. And I'm just waiting to be able to surf again. So,
I see you have your aubergine cup with you today.
Yes, I do. The infamous cup.
The infamous cup. I know you were on a couple of TV shows, the local news, and you were on Good Morning America.
Good Morning America.
Good Morning America. And I know you speak very highly of Novant Health, Brunswick Medical Center.
Yes, I do.
And
the cup was the least I could do was give them a little PR as I was doing my interviews, waving my cup around.
Well, I'm glad that you had a wonderful experience at the hospital.
I had a great experience at the hospital. They treated me like royalty, I guess.
That's great. That's great to hear.
Of course, I was like their star, you know what I mean? Really. I don't think they've ever had anything like that interesting happen to them.
Well, as I said, I'm glad you had a wonderful experience. However, I'm sad and for you that you had such an experience in the water, because I know how you love the water.
Oh, yeah.
But I'm sure that you'll be back in surfing before long.
Oh, yes. I will. And for anybody that goes out in the water, take the bling off.
Take the bling off?
Take the bling off. All that bling.
That attracts sharks?
When you're in the water, that sparkles, and it makes the fish, even bluefish, whatever, make them think that it's bait fish sparkling in the water.
Good for me to know, because I've always got the bling on, so
So
I have to be really careful when I go to the beach. And actually, I go to Holden Beach, so I have to be really careful.
So take the bling off, and usually the worst time to go out in the water is like really early in the morning, or very late in the evening, because once it's dusk or dawn, that's really when the sharks really tend to feed a lot more. Even though you'll see some during the daytime. But
well, great to know. Great tips for our viewers. So thank you again for being here so much. Thank you for sharing your story with us. It was very interesting. and you look so great. I'm so happy that you're in recovery, and I wish you the best.
Well, thank you very much.
Well, thanks for being here.
Thank you so much.
Our last guest is Dr. Stephen Robbins, a new urologist in the area. Welcome to the show today, Dr. Robbins.
Thank you.
It's a pleasure to meet you. This is the first time we've met, and I'm looking forward to learning lots about you today. So I understand you're new to the area, and how do you like it so far?
Besides being greeted by a hurricane or a tropical storm on my first week here, everything's perfect.
The weather's great. It's a little warm, but...
I'll get used to it.
You'll get used to it, that's right. Well, where did you relocate from?
I relocated from New York. I was working in Glen Cove, which is on Long Island, and left 17 years of practice there to move down here.
Wow, 17 years in the same practice?
Same practice.
Wow, that's awesome. Yeah, so you decided to move south and enjoy the sunshine with us.
Correct.
Great, great. Well, we're happy that you're here.
Thank you.
Well, talk to me a little bit about your work and your educational background.
I was educated in New York. I went to medical school at New York University, which is in Manhattan. And after 4 years of medical school, did my urologic training also in Manhattan at Mount Sinai.
Oh, Mount Sinai. Great,
so
great
spent
area. Great facility.
Long time in the city.
Yeah.
And then when I left Mount Sinai, I went to practice with another graduate from Mount Sinai in Glen Cove, which is on Long Island, and worked there for 17 years.
Wow. Well, that's quite different between Long Island and here, would you say?
It is different, but a better different.
Well, that's nice of you to say. So you have specialty training in urology, and where are you going to be located?
I'm working at Novant Health in the Brunswick Medical Center. The office is on the medical center campus.
Yes. And you do have a partner, is that correct?
Yes, the partner, Dr. Lydia Labachetta, who's been working there for 1 year.
And she's been on our show.
And I'm joining her and joined her 1 month ago. So it's kind of difficult to be in practice by yourself. It's going to be a lot easier for both of us to have a partner.
Yeah, that will be good. Now, some of our viewers may not know what a urologist is, so let's kind of start with the basics. What is a urologist?
Just an overview of what we do. We diagnose and treat the urinary system in men and women, so that includes the kidneys, the bladder, and we also take care of the urinary system and the reproductive system for men, which includes the obvious external organs and the prostate.
And the prostate. I hear a lot about prostate.
It's pretty popular diagnosis these days, especially on the news.
Yeah, especially on the news and on the TV commercials from the drug reps, the drug companies. Do you have any other special interests or areas that you're interested in?
I am a general urologist, so I have no subspecialty training, which I think is great in a community like this, because
it is.
In a community hospital or in a smaller community, you don't really need a specialist. If we need something, if Dr. Labachetta or I need help in diagnosis or treating subspecialty that we're not comfortable with, we have great medical centers around here to send them to. So I am a general urologist.
Good to know. But I understand that you do some procedures here, some specialized procedures, like for kidney stones.
Correct. Urologists have two components of our practice. We're in the office seeing patients, and we're also in the operating room. Okay. In the operating room setting, one of the things we treat is kidney stones. and I'm learning very quickly that we're in this, what we call the stone belt, and there's a lot of kidney stones around here. So minimally invasive therapies are available for kidney stone treatment. They include lithotripsy, which is sound wave or shock wave therapy. Very simply, you lie on a table, a machine goes under your back, and you break the kidney stones up into little pieces, and they pass without too much difficulty.
Does it hurt when they
Not really.
zap those?
You're kind of sedated, so it's not very painful. Okay. The second option of treatment we have is laser therapy. That's done in an operating room setting.
I didn't know about that.
You need to be a little bit sleepy, and then we insert lasers into the kidney and break up the stones that way.
Wow.
And the goal is to get the pieces small enough so when they move and they pass out of your body, they don't cause blockage and they don't cause pain.
Well, how big are they to begin with, generally speaking?
A stone can be any size. It can be a centimeter, 2 centimeters, which is like an inch. Stones won't come out by themselves if they're any bigger than like 1/4 of an inch. They'll get stuck.
Wow.
And when they get stuck, it's quite painful, and we meet the patients in the emergency room.
I've heard they are painful. I've never had one, but
it's quite impressive how you can take a grown man and bring him to his knees with a very small stone.
Yeah, they seem like they're so small that they could just pass. But well, those are interesting procedures. And now I know that you also see patients with incontinence. Is that correct?
Correct. So incontinence can be in men or women. In men, a lot of times incontinence is associated with the prostate. So we either treat them with medication or minimally invasive surgical procedures, also with the use of lasers. For women, incontinence is usually treated with medication or surgery. The surgery is for what we call stress incontinence. Stress incontinence is where you leak when you cough or you dance or you run around.
Okay.
And the medication is for what we call urge incontinence, which is when you feel like you have to run to the bathroom and can't get there quick enough.
Yeah.
And you're leaking on the way. That's the medication treatment.
That's the medication side.
Correct.
Ah. I'm curious, do you see patients with cancer?
Yes. Urologists are the primary diagnosticians and treatment for cancer of the kidney, cancer of the bladder, in both men and women, and cancer of the prostate.
I hear a lot about prostate cancer. It seems like
it's
very prevalent.
Yes, and there's a lot of controversy about who should be treated, who shouldn't be treated,
how old, and
who should have surgery, who should have robotic surgery, who should have radiation, and we could spend hours talking about that.
Yeah, we could. That would be that's another show. Will you come back and talk about that? Okay. Well, do patients need a referral from a primary care to see you?
Some do. It really depends on their insurance.
Oh, I see.
The easiest way to figure it out, to get an appointment to any specialist, is to ask your primary care doctor. If you're not sure, if you call our office, the staff will lead you through the maze of insurance to figure it out.
They can pretty much help you with whatever your insurance plan is.
Correct.
They can determine if, in fact, you need a referral. Is that correct?
Correct. Some insurances don't need referrals,
right.
Some do.
Yeah, it's funny. My husband and I have both different insurances, and I don't need a referral, but he does.
For instance, Medicare does not need referrals typically, and so younger patients less than 65 who have insurance through work may require it.
Yeah, well, that was great information. It's been a pleasure to have you on the show today, but before we wrap up, is there anything else that you would like our viewers to know?
The office is open 5 days a week, pretty much 9 to 5. And anytime there's emergencies, we're always available through the emergency room at the medical center.
Awesome. That's great. Great to know. Well, thank you so much for being here today.
Thank you.
I look forward to having you back, and we'll talk about another interesting topic around urology.
Thank you very much.
Thank you.
Pleasure being here.
Thank you. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, your local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.